Welcome, everyone. Thank you for joining us. My name is Victoria Keddis. I'm a mom. I'm a facilitator and manager with FamilySmart, and I get to host this wonderful event with Dr. Duncan today. With gratitude, we acknowledge that we are on the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. We know relationships matter, and we commit to deepening and strengthening our connection with the First Peoples on whose land we live, love, and work. Now, ADHD doesn't just affect the person with ADHD and living with it. It also affects all of those around them. There's so much that we can learn to have better understanding and be supportive of the people living with ADHD. So I'm so excited to have our guest today. He's not just an expert on ADHD, he's also an expert on himself. So I'm going to let him introduce himself. Enjoy the learning. Welcome, Dr. Duncan.
Thank you, Victoria. A pleasure to be here for this presentation. We're talking about ADHD, something that's very important to me, and I know obviously to the listeners as well. I come to this topic with both professional and personal interest. Professionally, this is my area of interest. I'm involved in research. I'm on national and international committees and boards related to ADHD. I've been working clinically with ADHD and individuals struggling with ADHD for a couple of decades. Manage a ADHD clinic focusing right now on university students. Personally, I myself have been diagnosed with ADHD and I have children with ADHD, so much of what I've learned has come both from my family, my personal experience, as well as the patients that I've worked with and their families. My goal today is to talk about ADHD. There's a lot of myths still surrounding this disorder and its treatment, but in my experience, I think many of the myths are dispelled simply by presenting what we know scientifically about the disorder, and that's my goal today, is to kind of overview what we know, to provide accurate, hopefully valuable information regarding this disorder. So let's get started. My goal is to provide an overview of ADHD because I find that there's a wide experience and knowledge about this disorder, varying from people don't know much about it to people are experts. So I like to make sure we're all on the same page before going into some of the details. So I want to talk about initially how common ADHD actually is and isn't out in the real world, and then talk about why ADHD even matters. And then how to diagnose ADHD. What is the process that I, as a clinician, and others might go through to determine whether you or your loved one has ADHD? We'll talk a little bit about what the cause of ADHD is, what the difference is between an ADHD brain and a non-ADHD brain, and then talk about some of the other common challenges that are present with individuals who have ADHD beyond the core symptoms of ADHD, because that then altogether leads us to understand why we approach the treatment of ADHD the way we do, and why certain approaches to treatment really don't make sense. So that's our goal tonight, is to overtake that path. So how common is it, and why does it matter? Well, contrary to popular myth, everybody and their dog doesn't have ADHD. Having said that, it is the most common mental health, single mental health disorder in childhood, with 1 in 15 children having diagnosable ADHD, and about 1 in 23 adults. The adult data is a little bit old, and it's probably a little bit higher than that. But the point is, it is very common, but not universal, obviously, in both childhood and adults. Having said that, contrary to popular myth, ADHD is not overdiagnosed. In fact, most individuals with ADHD, both in childhood and adulthood, end up not being diagnosed. It's either explained away by choice behavior, school's not their thing, etc., but it's missed. It's misunderstood or diagnosed as something else. In fact, this data shows that about 3/4 or 4/5 in adulthood of individuals with ADHD end up not being diagnosed. So that if we bring it closer to home in BC, there are tens of thousands of individuals going through life struggling with the challenges from their ADHD without being recognized, supported, and helped with their ADHD, unfortunately. So hopefully, as a result of, in part, this talk, you'll be more informed, others will be more informed, and more people will receive the help that they need and deserve. So why does it matter? Why do we even talk about ADHD? Why should we recognize it? Well, it's because ADHD isn't just a yuppie disease where everybody wants to concentrate just a little bit more and get better marks in school. In fact, ADHD is associated with significant negative outcomes if it's not recognized and treated. You can see here, and you can read them. I won't list them all, but we're talking about reduced health outcomes, employment problems, mental health challenges resulting from undiagnosed ADHD. Substance use problems are more common in individuals who have ADHD than those who don't. There's increased suicidal rates. Family challenges, problems with the law are more common. Academic underachievement, the list goes on. Oh, by the way, COVID is more likely to be caught by somebody who has ADHD than those who don't. You can imagine why that might be, but the data shows that an individual with ADHD is more likely to be COVID infected than those who don't. Perhaps the most concerning piece of data is the fact that individuals with ADHD are 4 times more likely to experience premature death relative to those who don't have ADHD. This is a serious disorder, not just associated with people who want to concentrate better or have an excuse for their challenging behavior. It is a serious disorder that needs to be recognized. And the more mental health challenges you have in addition to ADHD, the more risk you are for premature death. So how do we diagnose ADHD? How do we determine whether the individual in front of me does or doesn't have ADHD? Well, there are specific criteria that must be met. Obviously, the first criteria is that you have to have the symptoms of ADHD. So there are 3 groups of symptoms: inattention, hyperactivity, and impulsivity. And you can see the list here. In fact, I know this is a video, so if you need to, you can pause and actually read these. I won't go through each in detail, but the problems with attention to details, careless mistakes, forgetting to sign your name on a paper, forgetting to include a sign. You didn't read the whole question on an exam, and you make mistakes that way. Problems with sustained attention, challenges with mind wandering. This really shows up for adults commonly in conversation, where they're easily distracted and have trouble maintaining and sustaining their attention. Individuals with ADHD have greater problems reading fluently, partly because of challenges with sustained attention. They're the people who tend to read and reread or are slower readers because their mind isn't fully present while they're trying to read a paper or a book. And it's common for people with ADHD to say, well, I'm a very good multitasker. Well, usually what that means is they have trouble sticking to one thing. They have to do multiple things. They may consider themselves good multitaskers, but I always ask them, how are you at unitasking? And that's where they have troubles. They can't do one thing for a long period of time because of their challenges with sustained attention. Challenges with not seeming to be listening when somebody's speaking to you. Mothers commonly comment on how they have to take their child's head and turn it and look them in the eyes before they give them instructions, because otherwise they know it just won't be heard. Challenges with finishing tasks, good at starting but not good at finishing tasks. Chores, you may ask a child to go do something, they agree to go do it, but very soon they're off doing something else, trouble following through. Organizational challenges are very common. I like to think of organization in sort of 3 spheres. Organization of things, messy room. These are the kids or adults, university students are typical for this, who don't have a filing system, they have a piling system. They think they're organized because they know exactly which pile it's in, but that's not really what organization is about. Or if you look at their room, they have a floordrobe, not a wardrobe. Everything's all over the place. And then there's organization of time. Time management challenges are very common with individuals who have ADHD, commonly being late, having trouble showing up on time. They leave when the appointment's supposed to start. They forget to calculate for travel time. And then there's organization of thoughts. Most people stop, think about what they're going to say, organize their thoughts, and then deliver their message in an organized way. It's common when you're talking to somebody with ADHD to get the sense that they are not organizing their thoughts. They're just sort of throwing it all out there, and they expect you to organize it when you're listening to them. So organizational challenges in conversation is very common as well. Avoiding tasks that require sustained mental effort, very common. Think of procrastination, waiting until the last minute, waiting until it's very important or very intense and so that you can focus, and people get good at learning to procrastinate if they have attentional problems. But that's not an efficient way to accomplish things, unfortunately. Tending to lose things, misplace things, or you spend a lot of time looking for things. You may not fully lose them, but you're spending an excessive amount of time before you leave trying to find your glasses, your wallet, your keys, misplacing things, losing credit cards, losing phones, etc. And then distractibility, both external distractibility, things around you are distracting, noises, sounds, movement, and maybe internal distractibility where you've got thoughts that are constant. It's hard for you to kind of stay on track because thoughts keep coming to your mind that distract you from what you're trying to accomplish. And then forgetfulness, very common in ADHD, the need for reminders to get things done. The child who says, yes, I'll take the garbage out. They mean to, but then it doesn't happen. And after a while, parents start to wonder if they're just choosing to not do it rather than actually forgetting, because they can remember things when it's important to them. Well, we're going to explain a little later why that phenomenon occurs, where it seems that people who are saying they have trouble paying attention or remembering things can sometimes pay attention and remember things. And we'll explain why that is from a brain-based perspective. Symptoms of hyperactivity and impulsivity, I'm sure you're more familiar with. These are the kids that people typically think about when they think about ADHD. Being fidgety, having trouble sitting still, always on the go, running, climbing. Hyperactivity in adults often looks like it's an internal hyperactivity, restlessness, the need to be doing something, impatience. That's common with adults who have ADHD, and they may not be overtly hyperactive. Difficulty being quiet, always on the go, got to be doing something. The chatterbox, tending to talk excessively. And then impulsivity, blurting out answers, can't wait your turn, got to be satisfied now. Trouble with delayed gratification. This is the child that when they want something, it's so on their mind, they're bugging you constantly about it because they have trouble sort of settling themselves down. And then interrupting, butting into conversations, very common. So there's three groups of symptoms, but it turns out from a statistical point of view, people who have problems with hyperactivity are also the people who have problems with impulsivity, typically. So when you think of the diagnostic symptoms of ADHD, there's actually two main groups: inattention and hyperactivity and impulsivity. That's important because when we talk about whether somebody has ADHD or not, they don't have to have both groups of symptoms. You can have ADHD and only have problems with inattention. You do not have to have hyperactive and impulsive problems to be diagnosed with ADHD. So it's either or, inattention and hyperactivity and impulsivity. And in order to say that, yes, you meet the criteria of having the symptoms of ADHD, you have to have enough symptoms. Specifically, there's 9 symptoms of inattention. Children have to have 6 out of the 9. Adults have to have 5 out of those 9 symptoms present, and same for hyperactivity and impulsivity. Well, how do you know if a symptom's present? Aren't all of these symptoms sometimes true of all of us? I mean, as we read through those symptoms, you think, well, I'm sometimes like that. I'm sometimes like that. Well, for us to say the symptom is present, for us to put a check mark beside each symptom, it has to be present often. Now, a little caution here. Often means it's typically true of you. It is very commonly a challenge for you. Often doesn't mean sometimes, but neither does it mean always. So the diagnostic criteria isn't that your child can never pay attention. It's that they often have trouble with these inattentive symptoms, and that's true for adults as well. So if a symptom is typical of you, more common of you than it is for the average bird, then that is checked off as being a symptom that is present, and then you have to have sufficient number. Well, having the symptoms of ADHD is not enough for the diagnosis of ADHD. For you to have ADHD and be diagnosed with ADHD, 4 other things have to be true, according to the standardized diagnostic criteria used to diagnose ADHD. You have to have the symptoms, and you should have always had the symptoms. Technically, it has to be before the age of 12. So I see people who are 42 years of age and they say, well, I've been like this for 2 years. Well, that's not ADHD. That's something else going on. It should have been present in childhood. That doesn't mean you have to be diagnosed in childhood, but it should have been present in childhood in terms of the symptoms being there. In order for you to have ADHD, it should be in more than one setting. If you only have ADHD when you're doing math at school, it's probably not ADHD. It's probably something related to math. So to neutralize for that possibility, we say that it has to kind of go where you go. It'll be more of a problem in some settings than in others, but it should be in more than one setting. It has to be causing an impairment. If you read the symptoms of ADHD and you say, yeah, that's me, that's me, that's me, that's often true of me, but you're doing just fine, and I mean actually doing just fine, not that you think you're doing fine. I'll ask your spouse whether you're doing fine, or children, I'll ask your parents whether you're doing fine or having challenges. But there has to be an impairment. If these symptoms are causing an impairment in your life, functional challenges in your life, then that meets the criteria. And the last one is, if there's something else going on, and there very commonly is when somebody has ADHD, such as depression, anxiety, learning disabilities, autism, etc., before we diagnose ADHD, we have to be confident that the ADHD symptoms are separate from those other things. Now, caution, that doesn't mean you can't have anxiety or depression. It just means that if you've got anxiety, I'm not going to diagnose you with ADHD unless the ADHD symptoms are separate from the anxiety. And we'll talk about how we do that in a second. A little bit of information that might be helpful as well. The symptoms change in individuals over time. Hyperactivity tends to diminish through our life. That's true of everybody, and it's also true of individuals with ADHD. They may be hyperactive when they're younger and not be hyperactive when they're older. That's what's led in the past for adults often to think they outgrew their ADHD because, I used to be hyper, now I'm not, I don't have ADHD anymore. That's not necessarily the case. Impulsivity tends to peak in adolescence and then diminish again in adulthood, but inattention tends to live on. The result of this is most children with ADHD, not all, but most children with ADHD have hyperactivity and impulsivity as part of their ADHD presentation. But a word of caution for adults. Most adults don't have hyperactivity and impulsivity as part of their. So if in your mind you've got a template of somebody who's hyperactive and impulsive, a clinician will miss most adults with ADHD. So it's best to focus on the inattentive symptoms and then also notice the impulsive and hyperactive symptoms being present if they're there. So if you have ADHD, what makes you have ADHD? How is it that you came to have ADHD? Well, we've got very good, actually conclusive evidence now. The evidence is so overwhelming, but I'm going to present it in a very brief way. We could do a whole day of the evidence supporting this. This is a brain-based disorder. If you have ADHD, there are certain areas of the brain that are underactive. If we measure their functioning compared to the average person, they will be active at a lower rate than it would be for the average person. And I keep saying you, but it applies to me as well. I told you I have ADHD. So there's certain areas of our brain that are underactive, and we're going to explain in a little bit why that matters and how it helps us understand the nature of ADHD. But this is about specific areas of the brain being underactive. Well, how do they get to be underactive? Well, it's very clear from the evidence we have, multiple studies showing that ADHD is primarily a genetic disorder. This is highly heritable. Heritability means if you're going to have ADHD, to what degree has genetics contributed to your risk of having ADHD? And you can see here that the risk of having ADHD is about 75 to 80% determined by your genetics. That's pretty close to your chances of having a specific height compared to your parents, and more than your chances of having schizophrenia. This is a very genetic disorder, and the result of that is clear. Because it's highly genetic, it tends to run in families. If somebody has ADHD in the family, somebody else in the family is likely to have ADHD as well. In fact, 5 to 10 times more likely to have ADHD. And you can see here specific data for if a parent has ADHD, what are the odds any given child will have ADHD? Or if a child has ADHD, what are the chances one of their parent likely has ADHD? 55%. And if one of your children has ADHD, any other of your children have a 32% chance of also having ADHD. So it tends to run in families. Here are some causes that sometimes have come up in discussion with people that actually don't have evidence. ADHD is not caused by toxins, at least based on the evidence that is available so far where it's been explored, and there just isn't evidence of that. It is not caused by poor parenting. Now, there is a strong association between parenting challenges and children having ADHD. And we won't take time today because we don't have time to review the evidence. But the fact is, it's not that bad parenting creates kids with ADHD, but children with ADHD tend to bring out the worst in parents. It can be challenging. It can be frustrating. It can be difficult because you parent them the same way you do other children, and it's just not going the same, it seems. And that can be frustrating and challenging. So yes, there is an association between challenged parents and child having ADHD, but the causal direction is the reverse of what most people assume. Diet and nutrition doesn't seem to cause ADHD, according to the evidence. No, this is not just a Sesame Street generation where they're used to things going quickly and they need to learn to sit still. It's not caused by culture, and it's not caused by allergies. So let's talk about how the ADHD brain, which is born that way, is different from other individuals and how that relates to the symptoms that they're having. Well, just understanding the nature of the ADHD brain helps us explain certain, sometimes puzzling things about individuals with ADHD. Why is it that if they have problems paying attention, they can sometimes pay attention? In fact, it looks like they can pay attention when they want to. So is this just choice on their part? Why do they sometimes hyper-focus? They have challenges with attention, you're saying, Doc? But I've seen them pay attention for like 4 hours at a time with their PS4, or when they're enjoying doing something. We can't stop them from building Lego. That doesn't look like an attention problem. Why are they less likely to learn from approaches like punishment, etc., which is true about individuals with ADHD? And how and where do medications work in the brain? And why is it so common for individuals with ADHD to have reactive emotion problems? Well, all of these things relate to the way the brain functions, and that explains it. So there's sort of two systems in the brain that have gone wrong optionally when somebody has ADHD. One is the braking system, and I showed you the caudate nucleus. This is the braking system in the brain. This is responsible for putting a pause on things. What's supposed to happen for most people is they get an impulse to do things, and then they stop for a second. They put the brakes on and they think, should I, shouldn't I? What happened last time I did this? Is this a good thing or a bad thing? And then they make an executive decision to do or not do what they got an impulse to do. Well, if you're impulsive by definition, your brakes aren't working, so you don't stop and think before you act. You get an impulse, you act on it. That's impulsivity. And then you might think about it, or over time get so frustrated with messing up that you start making excuses for why you did it, even though you know you really didn't think about it, you just did it. It also, that same brain system doesn't just relate to how we behave and act, it also it affects how we feel things. So individuals with ADHD commonly have impulsive moods. Not only do they act without thinking, they tend to feel without thinking. Every emotion seems to be big. When they're angry, it's World War III. When they're sad, it's the end of the world. When they're happy, it's everybody around them's irritated with how nauseatingly energized they are. Just calm down, settle down. And so everything's big because the braking system isn't working. I like to tell kids that they're superb Ferraris, but they just don't have very good brakes. So there's nothing wrong with them, but their braking system is not working. So helping them understand that this isn't, and helping parents understand that this isn't choice on their part. This is a brain-based challenge with putting the brakes on the same way other people can. And then learning and understanding the way the attention system works in the brain, I find fascinating, and I think it really explains some of the challenges we observe. And the executive part of the attention system really occurs in the frontal lobes of our brain, the prefrontal cortex. But before we talk about the implications of that, it's helpful to understand sort of the beginnings of the attention system. There's an area of the brain called the parietal lobe, or the parietal association areas. This is the part of the brain that's responsible for noticing things. It's responsible for catching all things that come to the brain. Right now, there's all kinds of things coming to your brain, whether you notice it or not, if your attention system's working. There's the pressure of the seat on your butt. there's thoughts about what are you supposed to do later. You've got to put that out of your mind for now. There's probably noise around the room. Maybe your computer's fan is making noise. All of that's coming at your brain at once. We notice things, and we specifically notice things that are bright, things that move, or things that are very loud. That's easy to do. That's a passive process. There's nothing wrong with that part of the brain when individuals have ADHD. That's why they can pay attention to things that catch their attention. But, well, that explains, I guess, why video games are so attractive and easy to pay attention to, because they move, they're loud, they're bright. Nothing wrong with that part of the brain when somebody has ADHD. So they can notice things just like everybody else, and things can catch their attention just like everybody else. That's not where the problem is. The problem is with another area of the brain, because you can't go through life just doing things that catch your attention. Sometimes you have to, quote unquote, discipline yourself to do other things that aren't quite so interesting, like read, do homework, do your taxes, have conversations with people that aren't interesting. You have to choose to do things that don't catch your attention. That's where the prefrontal cortex comes in, because what its job is to modulate the parietal association area, to tune things. It's responsible for tuning down bright, noticeable things so that you can ignore them, and tuning up boring things so that you can pay attention to them. So this probably shouldn't be called attention deficit disorder. It should be called attention management disorder, because it's about not being able to choose what you're going to pay attention to and what you're not going to pay attention to. You're in a passive state where whatever catches your attention, you're at the mercy of whatever grabs your attention, and it's hard to choose to pay attention to things. It's hard to pay attention to things that aren't interesting, and it's hard to not pay attention to things that are interesting. That's why distractibility is a problem, because you notice things, you have trouble tuning things out. That's why they can hyperfocus. And that's why they have trouble not hyper-focusing. And that's why procrastination is such a challenge. Because 4 weeks before an exam, it's not important, it's not interesting, it doesn't catch their attention. But the night before an exam, now we can pay attention. So that's why people with ADHD often develop little stories about themselves. I can do better under pressure. I need a deadline. Because they learned that that's when they can pay attention for this reason. And this is the brain-based reason. Well, people have symptoms of ADHD, but individuals with ADHD also have other challenges commonly that aren't symptoms of ADHD. Social skills challenges, making and keeping friends. I talked about emotional reactivity, very common. Individuals with ADHD, the research shows, are more personally sensitive. They feel things more than other people do very commonly. So imagine how cruel that is, the way life has set them up. Not only do they have symptoms that end up setting them up for lots of negative feedback from the world, they feel the negative feedback more than most people do. And that's why they struggle so much sometimes with the secondary effects of depression and anxiety and frustration and getting into the wrong crowds over time, and we'll explain why that is in a second. Motivational difficulties and family conflict, far more common. And it is true that it is more common for individuals with ADHD to have other health and mental health challenges than people who don't have ADHD. You can see here the rate of all of these other disorders: mood challenges, sleep problems, oppositional challenges are present more commonly, substance use challenges, learning difficulties. So the question commonly comes up, so if somebody has, say, anxiety and they have ADHD, how do you tell those apart? How do you tell that they have ADHD separate? Well, from a diagnostic perspective, I find it's not difficult. It's just a matter of paying attention to the patterns of the symptoms that they're having. Most of the things that can create challenges for diagnosis are also commonly present with individuals that have ADHD. But they have a different pattern. ADHD is always there. It might be more of an issue in some settings than in other settings, but the level of ADHD you have is the level of ADHD you have over time, generally speaking. Whereas other disorders tend to come and go, or they're particularly problematic in specific situations, such as a learning disability. So for something like anxiety, for instance, trying to differentiate from ADHD, we focus on those times when you're less anxious or not anxious. Do you still have ADHD when you're not anxious? Or before you ever became depressed, did you have these challenges, say in childhood? Well, that tells us then that it's probably a separate disorder. ADHD is separate from your anxiety. So we focus on the timeline and the context. What about treatment? Well, before I talk specifically about how ADHD is managed and treated, I want to give you the background that leads us, given what we've just all discussed and learned about ADHD. That sets the groundwork for understanding why we approach treatment the way we do. I've just spent time explaining to you and helping you understand that individuals with ADHD have lots of difficulties very commonly. They have problems with inattention, hyperactivity, and impulsivity. They have other non-specific associated challenges, and they may have other mental health disorders that have been diagnosed. All of these things that are present through no fault of their own. They were born this way. They didn't choose to have these difficulties, but they've got the difficulties, and these difficulties create problems with functioning. They do less than they're capable of doing because of the interference of these challenges. You go through life having poor functioning in multiple areas, by definition. Peer conflicts, school challenges, family conflicts, maybe difficulties at work. People with ADHD see themselves doing not well in multiple settings. And that results in this chronic negative feedback that they're receiving. They're going through life getting the message that they're messing up, that they're not doing well. They know they're not doing as well as they think they're capable of. And you can only take that so long going through life, and you need to start protecting yourself. And this is often the case where individuals with ADHD start to protect themselves by building an emotional wall to protect themselves. That's when they start developing an attitude to keep people at a distance, to keep themselves safe. Sometimes people get such a thick wall that they can't even see themselves what they're doing wrong because they can't afford to see themselves any longer doing, because they just can't take one more voice, their own, telling them how they're messing up. So this wall is then what leads to even further problems with conduct challenges, oppositionality, depression, anxiety increases because of this wall and division and separation that occurs between them and the ones they love and care about. And then substance use challenges become more. So this whole pattern of challenges leading to chronic assaults and negative feedback constantly that they're getting, and them needing to protect themselves, and then that protection leading to problems, explains why this is not the right approach to treating and helping people with ADHD. They don't need to go to boot camps. They don't need more discipline. They don't need some more negative feedback telling them how they're messing up, because what will be the result of that? A thicker wall, more attitude, and more risk of things going negatively for them. So what isn't helpful is punishing symptoms Remember, they have these symptoms through they didn't choose them. Punishment is intended to encourage people to make better choices. Well, why are we encouraging them to make better choices while at the same time saying these things aren't choices on their part, that these are challenges resulting from brain-based difficulties? So it doesn't make sense to use punishment to discipline ADHD symptoms, and it turns out not to be effective. It's less likely to work with individuals who have ADHD because in order for punishment to work, next time they act, they have to consider the consequences. But we said they're impulsive by definition, so they don't stop and think about the consequences. And so it's less likely to work, and the evidence shows it's less likely to work. And more concerning, it can be harmful. Evidence shows that use of punishment increases risk for anxiety and depression, especially the more we use it. And the evidence shows that if our goal is for them to internalize our sense of what's right and wrong and morality, punishment actually doesn't do that. In fact, there's some evidence that it may do the opposite effect, where they're less likely to internalize our view. What is helpful in terms of a general parenting approach is clear communication about what your expectations are. But then when children fail to meet the expectations you've communicated to them, you take a positive, supportive, and collaborative approach to solving problems with them. That's the general approach. If you want specific strategies on how you might do that, I recommend you get very familiar with an approach developed by Dr. Ross Green out of Harvard University called Collaborative and Proactive Solutions, CPS. I know FamilySmart can help you with that, and I'll give you some websites later that will help you learn more about that approach. So we've established this whole road for ADHD, and this illustrates why we treat ADHD the way we do. We want to start by reducing the impact of the symptoms, and that's done through what we call psychosocial treatment, which are non-biological treatments. The goal is to minimize the impact of the symptoms so that they're getting less negative feedback and chronic assault on their self-esteem. A good psychosocial treatment approach includes the components I listed here: learning about what ADHD is and what it's not, understanding what an individual or family want to accomplish in terms of goals, and then developing skills and strategies to achieve those goals, compensating for overcoming the symptoms that they're experiencing, and also adapting the environment to be more friendly for somebody who has ADHD, so that similar to how we build wheelchairs for people who have difficulties with mobility, we build an ADHD wheelchair. We adapt the environment so that it's easier for them to function in their particular environment. They might need reminders at specific times, and we encourage them to ask for reminders, for instance. And one approach to achieving this, there are others, but I'm a big fan of ADHD coaching, which is actually not therapy for ADHD. It is coaching. It's learning about what ADHD is, developing strategies, and et cetera. So we'll talk about that more in a second as well. But I'm sure you'll agree that if all we're doing is helping to reduce negative feedback and helping to develop skills to the best we're able, and to cope with the ADHD, we may not fully be doing everything we can. And that's where biological treatments come in, where we're trying to actually reduce the impairment and the symptoms so that there's less to have to cope with. There's less functional impairment in the first place, which will have significant downstream effects. There are two approaches based on evidence. One is essential fatty acids. There is good evidence that essential fatty acids can have a small effect on reducing the symptoms of ADHD. It's not a big effect, but it is a real effect. It certainly doesn't come close to the effects for medications, but we do recommend using those. They're usually not recommended as replacements for more effective treatments, but consider them. And then there's medications, which I want to talk to you about. When it comes to medications approved in Canada to treat ADHD, there are two groups: stimulant medications and non-stimulant medications. Stimulant medications, there are two of them. Stimulant medications work by stimulating areas of the brain that are underactive. And then there's a couple of non-stimulant medications. There's no way to know ahead of time which medication is going to be the best match for a given individual with ADHD. But we do have some research evidence about which ones are most likely to be effective. And we follow that evidence first to give it the best chance of finding the best one. The evidence shows that stimulant medications are more likely to be effective than non-stimulant medications. And there are two stimulant medications, as you can see named here. Those are the sort of the drug names of the two medications. Which one's better? Which one should you start with? I can't tell you, because generally speaking, they're equally effective. There's no way to predict which one's going to be most likely to effective. What we do know is that for the general population, they're equally effective. But for a given individual, one may be more likely to be effective, and we can't tell ahead of time which one it is. So we usually start with one, and then if that's not the one for you, we might then try the other one. I said there's two stimulant medications, but there's various versions of each. So you can see that all of these green ones are the same medicine, but they differ from one another primarily in how long they act through the day. With the shorter acting ones having to be taken multiple times in the day, they are somewhat more likely to have nuisance side effects than the long-acting ones, and maybe less likely to be effective than the long-acting ones. The research shows that the long-acting medications are more likely to be effective than the short-acting medications. So what that means then is if I'm choosing a medication for somebody that's going to be started on medication, I'm going to start with a long-acting stimulant medication from either class. And what we do is, just like we can't predict which one's the best one for you, there's no way to predict the right dose. It has nothing to do with age, weight, gender, how severe your symptoms are. Some people do better on a low dose, others on a high dose. We start at a low dose, and then we try to find the right dose by increasing it as frequently as weekly if we need to try and find the right dose. Whatever these medications do, they do right away. And we increase it until we either fully treat the ADHD, we get to the maximum recommended dose, or we get to a dose that won't let us go any higher because you're starting to have side effects that are intolerable and they don't go away. No harm. Every side effect stops when we stop the medication. Let's talk about side effects. Side effects start early. They're typically nuisance type side effects. It's probably best to think of the typical side effects of these medications as being typical of any stimulant, including caffeine. The most common ones are trouble getting to sleep at night, decreased appetite. They often resolve if you just stay on the medicine for a week or two, but they don't always. They do stop when you stop the medication. I want to highlight these medications, contrary to popular myth, are not addictive. You do not become dependent on them. Taking them now will not make you need the medication in the future. So we start with a long-acting medication. Which one should you start with? I can't tell you which one to start with because there's no evidence to tell you which one to start with. I can tell you which one to try second. It's the one you didn't try first. The evidence is clear. You should start with a long-acting. Then if that doesn't work, you move on to a long-acting. And if that doesn't work, you go on to a non-stimulant medication, or you might add a non-stimulant medication. That's kind of the Canadian guidelines for medication treatment. How do medications work? They work by stimulating those areas of the brain that are underactive that we talked about earlier. Certain areas of the brain are underactive. Research shows that when you start somebody on a stimulant medication, it stimulates those areas of the brain to make them more active, normally active, in fact. The benefits of medication are to decrease symptoms, which results in increased functioning. Think of the ADHD road. That's our goal. Reduce the symptoms to improve the functioning so that things go well, you can achieve your potential, and there's less negative outcome as a result of that. And the evidence shows that's what happens. Starting on ADHD medication leads to, it doesn't directly improve social skills or self-esteem, but it leads to that as time goes on. The reduced family conflict, positive feedback occurs more commonly, and it reduces the risk of complications that can occur. Risks such as motor vehicle accidents are reduced. Criminality is reduced in individuals who have ADHD. There's research showing that individuals with ADHD who are incarcerated are less likely to reoffend if their ADHD is treated when they're discharged. from prison compared to those who aren't treated. They're more likely to end up back because of the impulsivity challenges. Life doesn't go well. Contrary to popular myth, treatment with a stimulant medication reduces your risk of getting into substance use later. It doesn't increase your chances, and improves the risk or decreases the risk of depression, anxiety, and oppositional defiant disorder. I want to kind of close here by just giving you a real world example of a 7-year-old girl I saw in my clinic. She was given, the whole class was given an assignment. They were given materials and asked to make a flower. And that's what they were supposed to do with these materials. And this was her accomplishments. Not too bad. She's a 7-year-old girl, but a little bit scattered, and not so much attention to detail. Mom, we talked about options and etc. And Mom chose to have her child go on medication, as was our recommendation. And 1 week later, the teacher actually gave the class the same assignment. And this was the result of this child now on treatment. My goal in showing this is simply to say there's a myth out there that we give kids medications to control their behavior. That is not the goal of medications. The goal of medications is to return self-control to individuals so that they can perform to their best. It improves functioning. It doesn't just reduce bad behavior. And so the goal of any treatment is to improve functioning, improve real world outcomes. These are some resources that you can, you might want to pause the screen here. These are some resources that I recommend you access. FamilySmart is an excellent resource for family support, sponsoring this talk, which is also an excellent choice, helping you learn more about ADHD. CADAC is the Canadian Patient Support and Advocacy Group. Excellent information on there, details about specific strategies for specific symptoms that might be helpful, school accommodations, information about medication, other things. I recommend you go to CADAC. I talked about collaborative and proactive solutions with Dr. Ross Green. This is his website. I recommend you go there and learn about these approaches for parenting kids who are having difficulty, and I worded it that way. Kids with ADHD are not being difficult, they're having difficulty meeting your expectations. And this is a parenting approach that will help. And this is one website for ADHD coaching. And I want to let you know that's my brother's website. He is an excellent ADHD coach. So I'll disclose that. But it gives you an example. There are other coaches out there, but ADHDinsideout.com has good information regarding ADHD, brain functioning. But that's an example of a coaching site as well. So thank you very much for taking time to learn about ADHD, and I'll return it to you, Victoria.
Well, Don, thank you so much. So many great strategies to consider, and you took us from a place of concerning data to strength-based and all these strategies that we can do. So grateful that there, as parents, there's things we can do, and grateful for the reminder that it's not that our kids are giving us a hard time, it's that they're having a hard time, and medication is about giving them the best possible. And these strategies are about giving them the best possible life and functioning and thriving. And you're a great example of that. So thank you so much for being with us, for sharing what you know, your lived experience, and for giving us some strategies to begin with. Thanks for joining us. And thank you so much to our funders who allow us to do this great work with you. And thank you for taking the time to be with us and learn with us. We wish you well.